Welcome to the clinic. So in today's explainer, we're going to talk about something incredibly important, how you and I can work together to protect our newest and honestly most vulnerable family members from canine parvovirus.
As a vet, one of the biggest questions I get is how we protect our puppies from threats we literally can't even see. Well, my goal today is to guide you through understanding this virus, spotting those early warning signs, taking swift action, and ultimately, building an unbreakable shield of prevention around your best friend. All right, let's dive right in.
Section 1. What parvo is and how it spreads. So, canine parvovirus, or CPV for short, is this highly contagious virus. It brutally attacks the rapidly dividing cells in your puppy's intestines and bone marrow. It primarily targets puppies that are, between 6 and 20 weeks old. And that's exactly the window of time when their tiny developing bodies are just extremely vulnerable to attacks like this. But what's really daunting about this threat? It's how easily the virus travels. This bug is incredibly hardy. It spreads easily through direct contact with infected dogs or, their feces. But get this, it also survives for months on contaminated surfaces. We're talking kennels, water bowls, and it can even hitchhike right into your home on our own unwashed hands, our clothing, or the bottoms of our shoes.
Moving on to Section 2, critical warning symptoms.
Because this virus can literally survive for months out in the environment, knowing the early warning signs is absolutely your most powerful tool as a pet parent. You gotta watch your puppy super closely for these red flags. I'm talking sudden extreme lethargy, a complete loss of appetite, persistent vomiting, and severe, often bloody, diarrhea. You might also notice a fever, or actually, scratch that, sometimes it's a remarkably low body temperature just because they're so small and getting so sick. And if there is one absolutely crucial point to remember, it's this. Time is critical. If you see any combination of those red flags, do not wait a single moment. The resulting dehydration is severe, and it is life-threatening. You need to call your vet immediately.
Section 3, treatment and immediate care. Now, if your puppy does contract the virus, prompt intensive veterinary care in the hospital is absolutely vital for their survival. You see, as your veterinary team, we can't actually kill the virus directly. There's no magic pill. Instead, our job is to provide round-the-clock intensive supportive care so your puppy's own immune system is strong enough to win the fight.
Typically, we're going to need to admit them for about 5 to 7 days. During this hospital stay, we're doing a lot. We administer continuous IV fluids to replace those massive fluid losses. We give IV antibiotics to protect their bloodstream from bacteria that might be leaking out of a damaged gut. Plus, we're giving powerful anti-nausea medications and heat support just to help those little guys conserve whatever energy they have left.
Section 4, prevention and vaccination.
So, while the treatment process is, quite frankly, exhausting, intensive, and expensive, the fantastic news is we have an incredibly effective way to prevent this heartbreak entirely, and that is vaccination. It's an absolute must. It basically requires a series of combination shots starting right at 6 to 8 weeks of age, and we give those doses every 3 to 4 weeks. That final super crucial puppy dose happens around 16 weeks, which is then followed by a booster at 1 year of age and regular lifelong boosters after that.
Oh, and proper sanitation is vital too, especially since Parvo just laughs at most normal household cleaners. If your home has been exposed, you can protect future pets by thoroughly disinfecting indoor surfaces, bedding, and bowls. But you have to use a strict ratio, exactly 1 part bleach mixed with 30 parts water. At the end of the day, the power to protect your best friend from this really devastating illness is fully in your hands. Thanks for joining me for this explainer. I want to leave you with one final vital question. Is your puppy's vaccination schedule up to date? Let's work together to keep those pups happy, healthy, and safe.